Hi, everyone. Thank you for joining us today for the launch of Women in Big Data AI for Healthcare initiative. I am Divya, and I will take you through today's conversation with two of our industry leaders, Shala and Aruna, to give you a sneak peek into how we started working on this initiative and why we believe this is important for today's AI-driven world. Shala is a high-tech industry veteran with over 30 years of experience at Intel, holding roles in product development, management, marketing, industry standards, and ecosystem building. She also worked at Intel Capital as a strategic investment manager, gaining expertise in equity investment, portfolio management, and M&A. As the co-founder and COO of Women in Big Data, she champions women in technical careers. We also have with us Aruna, who is the Chief Product Officer at Exponential AI, leading the development of ENSO, an agentic AI-powered healthcare decision intelligence platform. She specializes in product strategy, GTM, UX, and AI-driven SaaS platforms with a track record of launching successful products like Trisus ChargeMaster, Velocity, and eBill. Aruna is also actively involved in multiple industry initiatives as a strategic advisor at Cognigent and a panel member for Harrisburg University's Strategic AI program. As the executive director of Women in AI for Healthcare, Aruna is bringing her passion and expertise to make AI more accessible for women. Thank you, Shala and Aruna, for being with us here today. I wanted to understand what inspired you to start the Women in Big Data initiative and how has the organization evolved over time?
Thanks, Divya. Nice to be here. We have started, Women in Big Data at Intel in 2015. So it's really, coming to our 10-year anniversary. When we started it, we looked to our own organization, and we only had a very limited number of technical female, like 12%. And one thing that we wanted to do to see if this is really, unique to Intel, for example, or other, companies facing the same issues, we reached out to our partners and, some of the companies that we work with in the Bay Area, and we got together at Intel, 15 of us, the original 15, and really, looked into the problem that we had and the similar issues, for everyone. We formed, a chapter. We decided we're going to go ahead and start, Women in Big Data, really focusing on supporting women to get more into this technical field and specifically to the data field, as we really find out that there is real issues and fairness that we need to have more female representation in this field. With that one chapter, we are now actually evolved to over 50 chapters, and chapters are in North America, in Europe, in Middle East, and in Asia. We have over 22,000 members, and we're focusing on providing training and mentoring and networking opportunity, along with supporting our members with the job opportunities. And that has been really a driving force for getting our community a safe place that they feel comfortable, and they really supporting each other's also. And the other thing that we really want to have more of leaders in this field and having role models for others to join.
Thank you, Shala, and congratulations for completing a decade with Women in Big Data and for creating a strong community for women who want to get access into roles in big data. Arun, I want to kind of double tap to understand why do you think now is the right time for launching the AI for Healthcare initiative in association with Women in Big Data? And what are some of the initiatives that you've specifically designed for the AI for Healthcare initiative?
Yeah, sure. So most of you know that healthcare is not necessarily an easy thing, right? So healthcare in itself is very complex. And the complexity stems from the fact that, of course, caring for patient and all the innovation that needs to happen for the diagnosis and as well as any other, right, clinical, any other device related innovation. There's a lot of innovation happening. And in addition to that, over years, data in healthcare is unstructured, right? Like, for example, physicians write their notes, right? And then a prior authorization comes in the form of an email or an image or a scan, fax. So all this unstructured data, and there are lots of policies and there are lots of job guides. So with all of this unstructured data and structured data, it is very difficult to put automation that lasts or that sticks or that is extensible. So now with the generative AI, right, it started off with AI, and then afterwards, a lot of maturity that we are seeing in the foundational models themselves. And now with the technology, agentic AI, there is a lot of opportunity from a technical standpoint. That barrier, we are overcoming that from a technical standpoint, right? So the healthcare as an industry is very regulated. So anytime there is a new technology coming in, it cannot directly be adopted. There has to be checks and balances. There has to be, for example, like a lot of regulatory checks on it. There has to be explainability, like everything has to be transparent, right? Anytime you're making decisions or you're taking actions using AI, the technology is finally coming to a place where all of these aspects are starting to look possible. And in fact, it is now proving that there is explainability, right? There is reasoning, and the agents can actually reach out to traditional systems. Like in all the healthcare environment, you will see a lot of investments, right, that happened over a period of time in different systems. So they're very disparate systems. So we don't want to go in and ask the payers and the providers to just rip their systems, right? So you got to go and put a technology that works off of that and then builds this intelligence on the top of it. So we feel it's the right time from a technology as well as adoption standpoint. And so that's what makes this the right time. Now, why is it the right time for us to start this global initiative? We talked about the industry aspect, the market aspect. Also, like, I'm very fortunate. I mean, we were able to put together a great team, like with you, Divya, heading our marketing. Ramya, you're our program director. And then we also have Anushka, who is also going to help us with curating the content, and Lynn Uten, who is also going to help us with training. So now that we have this strong team, and with partnership from Shala and rest of the WiBD leadership, we feel like it's a great time for us to be here talking about this initiative. Now, in terms of what specific activities we would be doing to help the members, right? So WiBD already has a lot of services, the foundational services that we are going to continue to leverage, like be it hackathons, be it the training platforms or training. Like, for example, most recently, there was this great partnership with DataCamp, right? So DataCamp sponsored. And I myself, I know like there are like 20 plus women who I was able to reach out, who are now actively taking advantage of the training program. Like, so a lot of such foundational services, career counseling are already there. When it comes to the AI for healthcare, we are going to add on few more from an industry perspective, right? The most thing, for example, the most important thing is the perspectives. So like I said, healthcare has so many personas, so many stakeholders. Creating a platform where you can directly hear the voice of a physician, the voice of an operational leader from a payer environment, right? The voice of a provider CIO or a vendor that is building products for both payer and provider collaboration, whoever it is. At the end of the day, this whole ecosystem, being able to hear their voices directly is the first piece of, I would say, stream that we are going to work on, called perspectives. Then, like, as I mentioned to you before, healthcare is complex, AI is complex. And we are talking about the intersection of AI and healthcare. If you think about it, that's a lot of learning, a lot of content. And even for someone to go and search to see how these two intersect, what specific aspects of innovation in AI is applicable to healthcare today, what is applicable 2 years down the road. That level of analysis or insight is not very easy to go and dig up, right? So second initiative that we have or stream that we have is what we are calling SIFT, meaning any curated content. There are some really good bloggers out there who are doing bits and pieces of this, bringing all of that content and making that available on through our platform, through our LinkedIn page, for example, is another avenue for the members to actually get very curated content that is applicable for their work and how they want to impact healthcare, right? And the next initiative is the Startup Spotlight. There are so many startups emerging, a lot of entrepreneurial ideas. Like most recently, I have students like who graduated from like MIT or Berkeley and coming up with these ideas. They're already involved in seed funding. They need a platform to talk about how their product is going to help, with healthcare innovation. So that's the third stream. Spotlighting those entrepreneurs is something that, I'm really passionate about, and being able to hear that new ideas. The next thing I would say is Campus Connect, right? So if you look into the education or the curriculum currently that's going on in the universities, I personally feel like they're behind, right? Like AI is developing so fast, healthcare is evolving with it, and all of that is not being taught in the colleges, right? So the goal for this program is to work with campuses, universities through our Campus Connect program and bring that practical, you know what I'm saying, application, practical knowledge, so that when students come out of university, they are not just equipped with theoretical knowledge, but maybe we help them with capstone, right? So that they can actually come out with some experience that they can actually apply towards seeking their first job. And finally, job alerts. We know the market is tough, and we know there are a lot of talented people. Like this morning, I had two very talented people reach out and say, you know what, I have the highest grade you can possibly think of. I'm graduating, but I can't seem to find a job, right? It's not because of lack of talent. I think they need some help at that age. I can only go back and think, at 21, like how much did I know about networking or job searching, right? Like being able to provide them with all the, any job alerts, intersection of AI and healthcare, right? So we will be able to repost them and make it known to those members who are willing to take our help in kind of, mentoring, not only mentoring, but also identifying the right opportunity and matching them to that opportunity so that, the employer is happy, the employee is also successful. So these are some of the initiatives that we are planning. Of course, there might be more. We might do more based on the feedback that we get. We're just about to launch now. So super excited about, working with my team as well as with WIB Data organization. And, as such, at the time of launch, I will not be surprised if we'll have more than like 30 members already rolled in with the launch. And our goal is to keep adding more membership so that we can impact more women broadly across the entire globe.
Thank you, Aruna. Thank you for sharing all the detailed insights, both from the complexities of healthcare perspective, as well as how agentic AI is kind of evolving the industry itself. And also, I really like that we have so many personalized activities planned for AI for healthcare. As somebody who graduated a year ago, I, kind of totally resonate with the challenges of job search, finding your first job in the US, and also with all the information fatigue that's there. SIFT is so important to be streamlining valuable content for our community. I'm sure we'll be able to add a lot of value through these activities, and definitely looking forward to be working on them. Shala, I want to understand when Aruna approached you with the AI for Healthcare initiative, how excited were you, and how does Women in Big Data aim to support the initiative?
Very excited, because we always look for opportunity for our community. And given that there are really, there is a gap, I would say, career opportunity where we think we can actually help, our members, our community, that's where we want to invest. And with Aruna expertise and leadership, we couldn't ask for any better combination. And really, it would help us to bring something new. We have been pretty much working on the horizontal aspect with all our services that we have been doing, but it's time to really, get more focus and find opportunity where our really, we can offer, some career, real career, opportunity to our members. What we can support, Aruna and the team is with all the infrastructure that we already have. Aruna already talk about them, but our mentoring platform, it is very well done. We have been doing mentoring for several years, and that's what we can use as the infrastructure that Aruna and the team can really capitalize and use that, as a service that they can offer to this initiative too. The same thing with the training. Runa talked about Data Camp. This is our partnership. This is second year with Data Camp, and Data Camp is offering actually AI related courses beside a lot of different, data related courses, which we can quickly offer it to, the community, to all the members in these specific verticals, and so on. Our podcast, our hackathon, and really, the event, the networking, all of them, we offer it, to make sure we jump started as quickly as we can. So we are here, we are excited, and we are here to really support this team, as this is amazing, opportunity for everyone.
Aruna, I want to understand more from the community perspective, right? Once we have the initiative rolling, since we're launching today, what is the kind of impact do you specifically want to have on the women who will be enrolling for the AI for Healthcare initiative? And is it kind of necessary for them to have a prerequisite of being in either of the industry? Is it open for everybody? I would like for you to, kind of put a spotlight on what do you want to create as an impact for women?
Yeah, sure. So when it comes to women in big data, the one thing I really that connected with me about women in big data is the target audience, right? So women in big data specifically targets three communities. The first one is the emerging technologies, like beginners, right? Come straight out of college, or somebody getting ready to get into the field, tech field. The second group is, the Phoenix group, which is like, women took a break. And I myself, at some point in my career, when I had my second child, I took a break, right? And then after 2 years, you try to come back, like being able to help them support. And then the third, the mid-level managers, right? So everybody aspires, anybody in the management aspires to grow. But what it takes to grow, right, from mid-level to the executive level. So that specific audience, giving them the necessary, I think in terms of identifying for each of these groups, having specific programs, I think we'll send a targeted, we'll have a very targeted strategy. Like for the beginners, it would be about maybe getting into their first job, right? So helping them with specific strategies around that. With the ones that come back, the Phoenix women coming back to work, it's about what skill gaps they have, right, that they need to build up so that they can get back into the market. Technology is evolving fast, and maybe getting them caught up on the specific aspects of technology, like we talked about AI here in this case, right? And for the third group, it's about leadership, it's about strategy, as well as, how do you execute for impact, right? How do you deliver impactful outcomes in whatever work we do? So that is how we believe will impact, like getting them jobs, or giving them the tools to kind of grow in their career or to come back into career. And it can be achieved. It's not a single, I don't think one single approach would solve this problem, right? That's what is exciting about this whole program, is all the, like maybe 10 plus services we talked about. We need to put all of them into practice for us to be able to make the kind of impact we want to make. So all of us are very excited to kind of kickstart this. And I am requesting everybody out there who is hearing this, message, who is seeing this video or who is hearing this, please, if you have interest in healthcare and have AI expertise, or if you don't have AI expertise, or if you haven't been in the healthcare, but most recently, for example, there was a product manager from a horizontal enterprise company, I'm not going to say the name, that want to kind of switch to healthcare because of the impact they want to make. Very smart, very capable, lot of AI experience, but they want to apply it for healthcare, right? Like that, we see a lot of people who are coming up with this vision for their career, right? So no matter what, talk to us, join the program. You will benefit from all of these streams that we are talking about, if not one, something else. And you'll also have an opportunity to shape this global initiative, make it more impactful and make it better. So welcome on board.
Thank you, Aruna. Thank you for sharing such a wonderful message. I think one of the underrated impact I would like to call out is just having like-minded women that you could reach out to just through a message, who are in the same kind of struggles as you at different stages of career. And I also think people like me who are very early on in their career have access to leaders like you, which is also a big advantage and also a guiding path to how you want to kind of charter your career. I think this is also a very meaningful impact that we will be able to create. And I would like to request everyone to stay connected with us on LinkedIn. Our page is launching, and we will add all the details in the description. And looking forward to our growing community and creating a lot of impact through this initiative. Thank you, everyone.
Yep. Thank you all.
Thank you.